Gauteng Health MEC Bandile Masuku and the representatives from the Commission for Human Rights is visiting the Mamelodi Hospital to meet the hospital management following reports of 76-year-old Martha Marais being ill-treated. Marais was captured on camera being tied to a steel bench while forced to lie down on the floor at the hospital. It is expected that the MEC will release a preliminary report into the alleged abuse. Let's cross there now to see what's happening.
The last time when we met with you as the media and also with the family that will come on Sunday.
Yeah, and if you can just speak a bit louder for us.
No, like I'm in a rally.
And louder.
Okay. Affair, ne? No, like I've said, good afternoon, everybody. We are here to give you a small brief of the progress that we have made on the incident that we've seen in the video of Mrs. Marais. We have done our preliminary investigations and we have received reports. The reports have revealed 4 individuals which were involved and who are in this instance on special leave pending their suspension, because remember we have to follow the labor law in terms of suspensions and everything. So after that we're going to enter into a full-blown investigation which will be independent, and we also welcome the involvement of the Human Rights Commission to do their own investigation, which hopefully will correlate what we find. And we are also, in the name of transparency and accountability, knowing very well that those who are involved, they need to be accountable. And this is a process of us not keeping you in the dark, always share with you what we are doing on the step of the way. We have done a preliminary redress with the family, with our HOD of the department, and we are going to continue to give psychological and social support to the family. Because it is a traumatic, I'm sure most of you, I didn't complete the video myself, because for me it was not something that should be done to any human being, especially people who come to our facilities where they expect assistance. But we are committed to making sure that we change things around for our people in Gauteng, and to also help our staff members with the difficult situations that they face. The shortages, they work very hard, and I think now they're starting to feel that we as the society, we are not actually appreciating those who are putting extra effort, our nurses and our doctors. But we are here and we are going to continue to work with you. I think I want the media to be part of the process of making sure that we change the situation around, not only to report negative things, but also to do positive stories that come out of our public hospitals and clinics. I'm with the members of TAC, the Human Rights Commission, a member of the legislature from the EFF is also here, and the local councillor of the area. But that's, yeah.
Let me see, you have not told us what happened. Why was she tied like that? What were the reasons? Did they give you any reasons?
See, the difficulty about health, particularly, let's talk about you when you see a doctor. You wouldn't want me to share things with the public, but the reports themselves indicate that there was a situation where they needed to act, to calm Mrs. Marais down, but the way they've done it was not the way that we normally do. But we have to be very careful, I know that we said we should be transparent, but also we should respect other things which remains to be confidential between the health practitioner and the person. And we also have to get consent, on whether we are able to talk about these things openly. But it's something that we are looking at. The full investigation will be there, and it won't be something that will be hidden. So let's get and wait for the process to come out.
Let me see, the representative from ENCA. Tell us more about the 4 individuals. What capacity are they in at the hospital?
Okay, the 3 individuals. The 3
or 4?
It's 3. Okay. I said this. Yes, thank you. There's 1 security guard, and there are medical officers. medical officers, meaning there are doctors, and 1 nurse involved. So we are looking at those numbers, and those are the ones that have been asked to explain why they are not supposed to be actually suspended. These are the ones that we're intending to put them into a disciplinary process and investigate further.
Right. If you can maybe just share with us, what is the standard operating procedure at hospitals when patients are maybe, violent or need to be calmed down? What's the operating procedure? And there's restraining procedure. And in this instance, you mentioned that indications are pointing to the fact that there was a need for her to be calmed down. What then maybe had gone wrong, or what then was different?
You see, the operative word, the operative word will be maintaining human dignity, but of course we use a number of things. We can give medication, and most of the time it won't be medication that you can swallow, because it will be a person who will be uncooperative, but it will be an injectable, and it's hard injectables like opioids, which are very hard drugs, high scheduled drugs, which usually come down, and then we normally do restrain. But if you look at the restrainers, you have to use a stretcher. The patient must be on the bed, in a stretcher, and then they need to be put on the restrainers. And those restrainers are not handcuffs as such, but if you can Google them, you will see them, And sometimes now the newer ones, when I started as a medical officer, they were a bit rough, they were leather made and strap, but now they are becoming more innovative with the new ones. So that's the standard way, but usually the opioids or the drugs, the calming drugs, are actually normally ordered by a medical officer.
Do we know what was used to restrain Marais? And do you know how long she was there for?
The indications show that it was almost over 8 hours. And now you want us to discuss the investigations, things that will be revealed by investigations, but the preliminary ones is that, and I think what came in between was the intervention of the family, which is something that is not good, because health workers are supposed to be advocates for patients, and that didn't happen. But let's wait for a complete investigation, so that when we comment in totality on the whole picture that we're going to be seeing. Let's not jump the gun. I know people want us to jump the gun. They want us to do. On Thursday already people were saying, but why not firing them as if we don't have a constitution? So there are a number of things, and those are things that we need to. We're a democratic country. We need to respect all the constitution. I saw on it 3 days ago that I will uphold the constitution.
You mentioned that the issues on overcrowding in these hospitals. Could this be the case, that there was not enough manpower to assist calm her down?
Possibly. It's one of the things that the preliminary report shows, that there are shortcomings in the hospital's infrastructure, particularly the emergency and accident department, which we call it casualty. And we are in a space where we are going to push DID, because it's a project that was approved in April. So for me, it's just to engage with the DID and make sure that we are able to complete the process. Because part of this, we need to, adverse events like these ones, in the health context, we need to use them to improve, so that if we don't go through such and then we don't improve, then it's a problem. Shortcomings of staff, yes, there is indeed, and those are things that we are going to work on.
You mentioned that she was tied for over 8 hours.
Probably. Yes, because
does
not
this
a
mean she had been
patient.
waiting for over 8 hours and tied at casualty for over 8 hours?
Not tied. I don't think tied was the over that, because she came on the 28th, the Wednesday, and then she was also then seen and restrained the Tuesday, and then Wednesday she was seen, and then that's when the whole incident we saw that went viral on the video happened at night on the 29th.
And you see, over and above this incident specifically, there's been allegations ongoing with regards to the hospital itself mistreating patients. What's your take in terms of ensuring that patients are going to be secured and treated fairly in the hospital?
And just to add on, MEC, to my colleague's question, just this morning we were at the hospital. I'm sure you did hear about the train accident that happened at the Mamelodi station. We also understood, you didn't. Well, there was a train accident. Various people were injured. In fact, scores of people were injured. About 30 were seriously injured and taken to various hospitals. One of them was Mamelodi Hospital. Now, we were there and we were told, even the activists that were there were telling us the same thing about how it took them hours to get to the injured people. So just to add on to my colleague's question.
What do you mean get to the injured?
To attend to them.
Oh, okay.
To attend to
All
them.
right.
People
Let's be specific.
people have been sitting on stretchers, sitting on beds, in fact even just sitting outside, waiting to be attended to.
Like I've said, I admitted when like I've said and admitted that there is a problem of shortage of staff, which we're going to look at. You know, like the way you're asking questions, like I've been here for 2 months or a month, it's only 3 days. I'm only going to go to the office tomorrow, but I've already scheduled a meeting with DID, also just to focus on the infrastructure problems of Mamelodi. Also, I've instructed the chief director of the district to work on the issue of getting more doctors for the space. I wouldn't have even myself, if I was a person who was triaging patients from the accident, taking them to Mamelodi because of the lack of capacity, you know. And we also have to utilize all other hospitals in the district, you know, and it's something that we're going to. So just keep me accountable on it, that we're going to sort out this Mamelodi problem with you, and we're going to take you all step of the way.
So does this mean that you haven't had a chance to go through the handover report and what the state of the province when it comes to health facilities is concerned? So you're saying you don't know the broader scale of the problems here in Gauteng?
No, you're using harsh words.
At this point.
You're using harsh words. As a person, as an individual who have worked in the space, you know, remember, I'm not coming from anywhere else. I worked at Bara for almost 8 years of my life. I worked in Telemokwerane for 3 years, you know, so I've spent all my life in the public hospital, so I know these problems, and that's why I also have sympathy on health workers, particularly in terms of their staff morale, and it's something that so I know the problems. All of us know the problems, you know, and we can't pretend that they are not there. We know our limitation of our clinics. They are small, they are tiny, they can't cater for the whole equal settlement. We know our 24-hour clinics have got problems of medicines at night, you know, so we know those problems, you know. So it's the issue that we have to now start the process of working together. Also, you know, I wanted to also give a challenge to the community, because there are things that usually don't really need the hospital, you know, and part of it is that we also have to take care of ourselves, you know. It's unbelievable the levels of trauma that we see, you know, which just relates to alcohol related, you know, stab wounds, gunshots, car accidents and all that. And usually it happens, I'm not sure last night what happened with Liverpool after winning, but usually in South Africa, with matches in South Africa, when some of the weekends happen, people themselves, like they're in war with themselves, you know. So we need to work and conscientize our communities to work together so that we are able to deal with people who really need hospitals and really need our system to help them, you know. A bit of headache after a heavy night doesn't really require a hospital, you know. You can treat it at home, but let's see.
One last question from me to you. Would you say that Mamelodi Hospital is in a crisis? Hearing the testimonies of people's experiences, you admitting that there is a shortage of staff, there's overcrowding issues and so forth, and of course with what's happened to Martha Marais. Is there a crisis in this hospital?
There are challenges, yes. You can, if you want to use crisis, yes. But the issue is that there are fundamental challenges that we need to deal with, of staff, infrastructure and all that. So I do agree with you. It just depends how you want to. It's a matter of semantics.
When do you expect the report back? The full report?
The investigation and the disciplinary process. We are hoping, usually they say that it can take 60 days, but we are hoping that we are going to cut it short. You know, we have made a commitment that we can't take it for longer. So over time, maybe a month, so that we do a thorough job.
Just one last one from me. There's a looming lawsuit. How are you going to respond to that?
We'll wait for it. We'll wait for it, and I think if we're at fault, we are at fault, we'll have to deal with it at that level, you know. But there are different ways of how to deal with issues of litigation, which of course are a problem, you know. And one of the things that I want us to have a discourse on is mediation, you know. It's not, people don't harm people intentionally. You know, I don't think somebody wakes up, get dressed and go to hospital as a health worker to go intentionally harm somebody.
But besides the lawsuit, MEC, there's also criminal charges that the family is pursuing.
Let the process continue. We're not stopping anything. You know, like I've said, we're in a constitutional republic, a constitutional country. Processes will follow. We've got Section 9, you know, Section 9 institutions. Chapter 9, we are transparent.
From the family.
Yeah.
Can you from the
Well, it was a press conference by the Gauteng MEC Bandile Masuku that we've just been watching. Moving on now, a devastating start to Child Protection Week as 3 children allegedly hanged by their